see the participant list starting to stabilize. So I think we can go ahead and get started. Neostiano, Sarah Stafford, Nigatso. I work with the Office of Child Care as a senior tribal specialist within the office of our director. And I would like to welcome you and thank you all for taking the time to join our webinar today, where we're going to discuss more information regarding the upcoming child count submission. Specifically, we are going to be discussing strategies for developing an accurate, comprehensive, and unduplicated count. And if you're just joining us, we do invite you to drop your name and say hello in the chat box if you would like to. If you have questions throughout, you may also add those to the chat box. We'll be pausing intermittently to respond to those. And again, thank you for taking the time to connect with us. We are recording today's session. It will be available both on our Tribal Child Care Capacity Building Center's website, as well as emailed out to all registrants. And just a reminder, please mute yourself unless you are intentionally trying to share information with us, which is totally fine as well. And we can go ahead and get started. Next slide. So today we are going to lightly review the child count requirements from the previous webinar. Share about the significance of the child count, both as an individual tribe and how it fits into all tribes' funding amounts. We will discuss implications and considerations for making changes to your definitions of Indian child or service area. There will be an opportunity to explore what conferring could mean for your program and hear how other tribes have approached meeting this requirement. And lastly, we'll touch on optional child count data sources and considerations. We have a number of interactive polls throughout this session, so we hope you check in with us throughout this presentation. Again, if you have any questions, feel free to add those to the chat box. And so with that, we are going to get started with our first poll question and go to the next slide. So since the last time that we met and or since the program instruction was released a few months ago, we are curious to know if you have taken any steps to start the process to conduct your upcoming child count that is due next year. And you can select all options that apply to you. So we want to know, potentially, have you located your current definitions that you're using within your program within the Child Care Automated Reporting System, or also known as CART? Maybe you located the methodology or approach that your tribal nation used from the last submission. Maybe you've only thought about the child count, which is okay. We want to know if you have started looking at or collecting data to support your child count submission yet. Have you started having conversations with any of your partners? Maybe you're wondering what a child count is, and that's okay too. You're in the right place. Maybe you just need help and you haven't taken any steps because you need to connect with your regional program office, which is also okay. And or if there are other steps that you've taken that we don't have listed here, you can select that. I don't know if there's actually an opportunity for you to describe. If there is, we'd like to hear what that is. If not, you could plug that into the chat box if you'd like as well. And so we'll give you a few moments to add your information there, select as many options that apply to you, and then we will publish those results in just a moment. Great, I see a few responses in the chat box. Carolyn shared that she has advocated with tribal leaders so far. Very proactive, I will say. I think, oh, hi, Deanna. You're asking where the tribal child care CTGR. That's probably in response to somebody introducing themselves in the chat box. But again, if you have any questions, feel free to add those in the chat box. Okay, let's go ahead and publish the results. Okay, Awesome. I am glad to hear that the majority of you have thought about the child count that's due next year. That's a great first step. I don't know if that's due to our webinars or maybe the PI coming out, or if, you started having those internal conversations and thinking about changes you might want to make for the upcoming submission. Nonetheless, glad to see that folks are starting to think about it. And it looks like a number of you have located your current definitions in CARS, found the methodology that was used from the last submission, which is great. Starting to have conversations, definitely an important preliminary step. And there's a couple of folks that are wondering what the child count is, and then also that need help, which is also important for us to be aware of. So again, as we progress through this presentation and you have any super confusing points that we are just not making sense for you today, add those questions in the chat box, but also be sure to reach out to your regional program office. They would be more than happy to support you and provide whatever information might be needed in order to help you understand the child count. All right, thank you all for participating and sharing your information with us. We can go ahead and go to the next slide. So again, we're going to do a super light re-review of the child count requirements. A lot of this information will be repeated from our previous webinar and also found in the various resources that we will be sharing with you today. Okay, next slide. So again, this program instruction is the foundation for conducting your child count and includes all of the statutory requirements. This document is very important, and if you haven't saved a copy yet, please scan this QR code, and maybe we could have one of our partners plug in the link to this PI in the chat box too. So this instruction is applicable to both ACF direct funded and Public Law 102477 tribes. And in order to be eligible to receive CCDF funds, a tribe has to submit this information every 3 years, which is used to determine the number of children to be used in your funding formula amount. The child count was a topic that we included in the Office of Child Care's request for information last year. We compiled all of the feedback and took a look at where we as an office have the authority to make some potential changes. And we identified some of those areas that we were able to impact, including releasing the program instruction at least a year before the child count is due. We heard the feedback from tribal leaders and others in the CCDF program that said that they need time to work on this, to partner with neighboring tribes and or to consider potential changes with their tribal leaders. So we worked really hard to get this program instruction published at least a year prior to submission. Another area was that tribes are no longer prohibited from collecting child count data prior to a year before submission. Instead, tribes are encouraged to select data sources that provide the most valid, reliable, and timely child count information. Another change that we made is that if your CCDF program is not a part of the consortium, you will not need to upload any documents into CARS, which will cut down on the administrative burden of this process. And lastly, if you are a part of a consortium, there is a new checkbox for member tribes in order to satisfy the demonstration requirement, which could cut down on the amount of documents needed to be uploaded in the CARS system. Okay, next we're going to discuss at a high level what some of the requirements are. So next slide. So again, every 3 years, as a part of the CCDF plan submission for direct funded tribes, all tribal lead agencies have to submit a self-certified number of Indian children who are under the age of 13 within their CCDF service area. And again, this is used as the foundation for your funding. The child count declaration or number is used by ACF to help calculate your grant amount every year based on the amount of funds that are appropriated by Congress. So for direct funded tribal lead agency, the submission includes both the self-defined definition of Indian child and service area. But if you are a 477 tribe, you still have to submit that information, but within your 477 plan, which doesn't always align with the triennial child count or direct funded plan submission cycle. Tribal lead agencies have the flexibility to determine the methodology and data sources used for your child count. However, you must confer with all overlapping and neighboring CCDF service areas to ensure an unduplicated count of children. And just a flag too that the child count can't be modified or changed within the 3-year grant cycle, except for new grantees coming into CCDF and or consortium member changes. Okay, next slide. So again, a bit about the definition of the service area. So a tribe's CCDF service area has to be on or near the reservation and therefore must be within a reasonably close geographic proximity to the delineated borders of a tribe's reservation. And there are exceptions for those that are located or share borders with the states of Alaska, California, and Oklahoma. And so that tribes that don't have reservations must establish service areas also that are within reasonably close geographic proximity to where their citizens reside. Okay, and then really quickly on the next slide, the definition of Indian child. So tribes have broad discretion in defining their definition of Indian child. So some of the most expansive definitions can be represented within this example, which is basically any child that is enrolled in or a citizen of and is eligible and or eligible to be enrolled or a citizen of and or who is a descendant of a federally recognized tribe. This also can include children that are adopted or are stepchildren within a native household as well. And a federally recognized Indian tribe means an Alaska or Indian or Alaska Native tribe, band, nation, pueblo, village, or community, which appears on the list of recognized tribes published in the Federal Register by the Secretary of the Interior. Okay, so now I am going to hand this off to my colleague to walk us through the significance of the child count. Meryl?
Thanks, Sarah. Hi, everybody. Thank you so much for being here today. My name is Meryl Borowski, and I'm a Senior Program Specialist in the Office of Child Care in our Program Operations Division Central Office. And I'm going to first take a step back and kind of talk a little bit about why the child count is so important and really the foundation for your CCDF program. So if we could go to the next slide, please. Okay. So the child count is required actually by our CCDBG Act that Congress passed. It's required every 3 years. And it is the basis for the funding, like how the amount of money that each tribal lead agency gets. So if you can see on the slide on the right, we have a screenshot of an allocation table, which are on our website, which lists how much funding each tribal lead agency gets. This is for fiscal year 2024, once Congress passes a budget. We take the child count numbers, they're put into a formula, and it's the basis for your funding. That's very simple, but that's like the general gist of it. The thing that I'm going to walk through on the next couple of slides is really also understanding that every tribal lead agency's child count really does impact everybody else's, because there's one pot of money that is reserved for tribal CCDF. But the child count is not only important for your funding, it's really also the basis of your program. Your definitions of Indian child and CCDF service area are the basis for eligibility. Oops, something is happening to the slides. Okay. Thank you. So we will talk a lot about this later in the presentation, but just want to emphasize that how you decide you are going to have those definitions is really also who are you going to serve and where are you going to serve them. So we can go to the next slide, please. So this is a very simple graphic that we just wanted to kind of share a little bit kind of how CCDF funding works with your child count. So every year, when maybe multiple times a year if we get a continuing resolution, but Congress will pass a budget and they will give a certain amount of money for all of CCDF, that the entire circle on the left. A portion of that money is reserved for tribal CCDF, about 3 to 6%. And then within that blue small pie slice, all of the tribal lead agencies funding is within it, right? So if Tribe A, which is the largest pie slice on the right, has a larger child count, their pie slice would be proportionally bigger. They wouldn't necessarily get more money because the pie slice on the left will kind of always be the same. If we can go to the next slide, we've shown it in a little different of a way. So this is a totally made up example, but if we pretend in the first bar graph on the top, child count submission 1, if we have $100 million and we only have 3 tribal lead agencies, Tribe A reports 100 children, Tribe B reports 200 children, and Tribe C has 500 children. That $100 million gets proportioned based on kind of the total number of kids. So the proportional amount of money. But if in the second scenario on the bottom, Tribe A has 400 children, Tribe B and C still have the same number of children, the Tribe A would have proportionally more funding because that $100 million hasn't changed. And so we just kind of wanted to share this and level set with all of you kind of how the funding works and why it is so important that all tribal lead agencies are really trying to have that accurate count, because all of your counts, do impact everybody else. And we want to make sure that we have the best and most accurate counts possible. So we can go to the next slide, please. Thank you. Okay. So we want to pause here for some policy clarifications that hopefully are helpful. So as you're thinking about your definition of Indian child, you might have this question: if my definition of Indian child includes citizens and or descendants of tribes other than my own, can I prioritize and or limit CCDF services to our tribal members? And the really short answer is no. So when I said a couple slides ago that your definition of Indian child is really the basis for your eligibility, that means that you can't prioritize certain groups within that definition of Indian child. However, the next question you'll see, you are still able to prioritize services. So tribes with medium and large allocations can set priority rules to ensure childcare services go to those with the highest need. It could be children experiencing homelessness, children with special needs, which might include vulnerable populations that's defined by the tribal lead agency. And you may also establish additional priority rules. So you can still establish those priority populations. They just can't be based on like tribal membership of a child, but you can say, do you know what, we want to prioritize all children experiencing homelessness in our service area because that's important to us. And that is completely your choice and your tribal nation's choice. In thinking about the service area, 2 clarifications we wanted to share. So one question you might have is, can we serve children who meet our definition of Indian child if they live outside of our service area? And the answer is no, but so in general, it is no, that the child must live within the service area, but the tribal lead agency can choose to serve families temporarily living outside of the service area if they're attending school or job training. So, so you can establish that little bit of flexibility, but in general, it's really families living within your service area. But then you might also have a question, well, what if a family living in my service area chooses a provider outside of my service area? And that is actually okay. Tribal lead agencies may pay for CCDF eligible providers outside of their service area. Again, the family just needs to live within the service area. So I hope that that is that clarified some things for you all, and we can move to the next slide. Okay. Oops, Sarah, I see you have your hand up.
Yeah, I just wanted to flag that we had a question come in the chat box from Deanna. And her question is, how does the consortium count as one tribe? And I think this has to do with the funding overview and impacts while you were sharing that information.
Yeah, that's a really great question. So I'll go a little bit deeper than the question. So in that pie, they would count as one tribe, right? Because the way that the child count works for consortia is that every member tribe submits their own individual child count, and then the consortia kind of adds it all up, and then you have the consortia child count number. So they would be a slice in that pie, but each of their member tribes would contribute to that number. So I hope that that answers the question. And please keep putting questions in the chat as we go through. Okay. So one of the things that we really wanted to cover in this webinar, for both those of you that have done the child count for many, many cycles and those that are brand new to it, and looking back at what was done in the last round, we really wanted you to take a moment and consider perhaps making changes. And not saying you have to, or for any reason, just that it's good sometimes to kind of reflect what was done, how things have been going the past 3 years. Are there things that you think that maybe changing your definition of Indian child or service area could, you know, make a change in your program that you're interested in? And so we have outlined on the next couple slides some questions that you can ask yourself as you're thinking about this. And again, you might decide, well, no, I think it's working well for us. The other thing that I just wanted to highlight here is that this is really your opportunity to exercise tribal sovereignty. This, there is a lot of flexibility and in your definitions, and really, you know, is your vision, your tribal nation's vision for how they want their CCDF program. And so this is really an opportunity to kind of look and see if what you've done previously is working, or if you do want to make any changes. So if we go to the next slide, we have outlined for you all, not at all an exhaustive list, but some questions that you can kind of start asking yourself if you're considering making a change on your definition. And so if you are either deciding to expand your definition or narrow your definition. So Sarah explained a very expansive definition of Indian child, but maybe you've decided that a more narrow definition, only tribal members or descendants of tribal members would fit. And so that's kind of expanding being the most broad and narrowing being a little bit more specific. But the first question that you should ask yourself if you're going to change your definition, either expanding or narrowing, is, do you have a data set that aligns with your definition? We're going to go into this later in the presentation, but really it is incredibly important that you choose a data set that matches your definition of Indian child. And so do you have a data set that you could use if you do change your definition? As I just walked through in the couple slides ago, just because your child count increases doesn't necessarily mean that there will be more funding, because it all depends on everybody else. But if you were to increase your child count, your definition of Indian child, and thus have more children in your child count, would you be able to increase CCDF services if you received additional funding? So something to think about if you're going to expand your definition. Are you does your tribal lead agency have the capacity to administer a bigger program? Kind of conversely, if you were to reduce your number because you have a more narrow definition, would you be able to run your program with less money? Would you have, you know, something also to think about is if you have challenges spending your current allocation. Well, if you narrowed your definition, you would probably receive less money. Something else to consider is whether they're Native families who currently don't meet the definition of Indian child in your service area. So what if you've had to turn a lot of families away recently? Over the past 3 years, there's families you've had to turn away because they don't meet your definition. So maybe you want to expand your definition. Similarly, if you were to narrow your definition, are there families who would no longer be eligible for services? And what would that mean? Would there then be an unmet need that you're, there would be families without childcare options, perhaps, and just something to take into consideration. The last two questions on each side are really about communicating with your partner. So if you're changing your definition of Indian child, who do you need to talk to about that? What partners do you need to discuss this with? And then another consideration you might have is whether or not you want to align your definition of Indian child with other early childhood or family programs or other programs in your community, and whether that's narrowing it or expanding it, just to align those programs so that, maybe there's a seamless program for families because you can have the exact same eligibility definition. And so you need to have those conversations with those other programs in your communities. So if we go to the next slide, please. We also have some questions for you to consider if you are considering changing the definition of your service area. So again, that first big question, do you have a data set that aligns with a change in your service area? The next question, which we are going to talk about in the next section, do other tribes already serve that area? So you are allowed to have overlapping service area. That is completely fine, but you need to confer with those neighbors or overlapping tribes with overlapping or neighboring service areas. So if you're expanding into another lead agency's service area, if you're decreasing your service area, are you going to create an unmet need for some families? Are there families who are no longer going to be eligible because they lived in that service area that you're reducing? Again, just thinking about unmet needs, perhaps in the last 3 years, you have families that you're just off your service area and you want to expand to be able to include them, and the opposite too, if they're no longer eligible. The two last questions on the left side just want to highlight, is the area near your reservation, except for in the 3 seats that Sarah mentioned. The CCDF regulations do say that the service area needs to be in close geographic proximity to your reservation. So if you are expanding your service area, it needs to be near your reservation. And then whether or not you have funding to serve more children. Just also something to note, expanding your service area doesn't necessarily mean that you would be counting more children. It might not, but if all of the children in that expanded service area are already counted by that tribe who you are now overlapping with, it might not increase your child count, but you'd have a larger service area. And so these are just things that we thought we could kind of share with you. You can think about if you are deciding to make a change. And so if we want to go to the next slide, we have another poll question for you all. So most of you from the last poll have started at least thinking about your child count, which is great. And just thinking about this conversation, do you think you might want to make changes to either your definition of Indian child or your definition of service area? And so we have questions. Yes, I want to expand my definition of Indian child, expand my definition of service area, or narrow. Either of those. No, we don't want to make any changes, or I don't know. So I'll give you a minute. I kind of want to reiterate while you guys are doing that, there's no right answer to this. It's what is right for you, what's right for your community, your nation, your children and families that you serve. We just want you to this is a really great opportunity because this is due again in a year, to just kind of reflect and see how these definitions are serving you and the families that you serve. Okay, so I see we do have one question in the chat that came up. So Donna asks, would that include a child enrolled in another tribe but placed in foster care within our tribe, as long as the child resides within the boundaries of our service area? That's a great question. It depends a little bit. It depends what your definition of Indian child is. So if your definition, even if your definition was really narrow, but so it's just tribal members, but it also includes, foster children, stepchildren who might not be tribal members, and the foster parents were members of your tribe, then yes, they could receive services. Or if you had an expansive definition that included, that Sarah shared earlier, if they resided in your service area, they could be counted. So can we pop up the poll results? And Donna, I hope that answered your question. Okay, so most people responded that they don't want to change their either definition of service area or Indian child, which is not I think too surprising. I think a lot of folks, wouldn't want to make that change. Some people are still thinking about it. You don't know, perfectly fine. We're early. And it looks like a couple people are thinking about expanding either the definition of Indian child or service area. And so I think Sarah and I are gonna say this a lot today. For any of those changes, it's always great to reach out to your regional office, your TCBC specialist, because they can really help you with any of this, but especially if you're making a change, they can really be great supports. So with that, I will pass it back to Sarah.
Great, thank you, Meryl. Okay, so next we are going to explore what conferring with other tribes or tribal lead agencies could look like for your program. But first, we would like to hear from you again. So let's go to the next slide. And we are wondering whether or not your current CCDF service area either neighbors or is near and or overlaps with another tribe's CCDF service area. So there's only a few options here. Yes, your service area does neighbor or overlap. No, they don't, and or you can select that you're not sure if you haven't checked on that yet. So we'll pause for just a moment and let folks make their selection before publishing. And since there's only 3 options, I think we can go ahead and publish the results. All right, that's kind of quick. Okay, so there's definitely a majority of folks who do have a neighboring or overlapping service area, an even smaller amount that do not, and a few that are not sure. So hopefully, as we walk through these next few slides, you can think about a process to start discovering whether or not you do have a neighboring or overlapping service area. Okay, let's go to the next slide. Okay, so we understand that primarily the purpose for conferring is to ensure that child count submissions don't duplicate information from one submission to the next or across multiple submissions, but we understand that there's a lot of other components to conferring and coordinating with other tribes that are also offering CCDF service areas, whether that includes talking about your service delivery models, how you all would prefer your own citizens be referred to your program or not. But for what we're going to be talking about today, we're focusing on conferring for the purposes of ensuring an unduplicated count. So as we've mentioned, tribal lead agencies may have overlapping service areas. There are no requirements that prohibit that from happening. We understand that there's a diversity of locations of tribal nations and how close they are to other neighboring or sometimes sister tribes. And we also know that some tribes are located in very remote places and may not have any close or neighboring CCDF tribal lead agencies or tribes. And so in this example, we're showing a very high level overview of how a service area could overlap or portion. But also with Tribe C on your screen, you see that they are not overlapping. However, their service area is still within close proximity to the other two tribe service area. And in that case, the folks are still required to confer and reach out and talk about whether or not their data sets are potentially duplicating any children. Okay, so let's go ahead and go to the next slide. So these are some optional action steps that you might consider taking in order to determine whether or not you have a neighboring and or overlapping service area. So of course, we encourage you to reach out to any tribal nations that are near yours who also have CCDF programs. You may be surprised that even though the tribe isn't very close next to you, that their CCDF service area could be a lot larger maybe than just their tribal headquarters location, right? And so we definitely encourage you to still reach out just to make sure that y'all are on the same page about the boundaries and the definitions of your service area. And again, you'll have to have the contact information for those neighboring and overlapping tribes. We recommend starting with the CCDF administrator. If you don't have that information, you can reach out to your regional office and see if they are able to share that information with you. And again, the requirement is to confer with those neighboring or overlapping service areas. And as always, we consider documenting this process. We understand that sometimes new staff come into tribal CCDF programs, and it's always helpful to see what was done in the past to coordinate meeting these requirements for the child count. So with that, let's go ahead and go to the next slide. So let's zoom in a little bit on the various approaches to conferring with other tribal lead agencies. So at a very high level, at a minimum, confer means to consult together, compare opinions, and carry on discussion or deliberations about CCDF and the child count numbers. And so that could look like a variety of different ways, and it often does. And momentarily, we're going to hear from several of you about your various approaches and experiences with conferring for the purposes of your CCDF program. So we have heard, though, from various tribal lead agencies over the years that conferring could include a formal MOA or MOU amongst tribes. Sometimes this process can be political, therefore tribal leaders want to be involved in this. A lot of the times it does include the CCDF administrator working with another administrator. They could include in-person and or virtual meetings, written communications, the sharing of different data sources, potentially doing a joint analysis of those data sources, and of course, discussing each other's approaches to ensure an unduplicated count. Okay, next slide. And again, at a minimum, we understand that it is critical to share a minimum amount of information when you're conferring for the purposes of a child count. So it necessarily follows that that would include your definition of Indian child for your CCDF program, as well as your service area, maybe the data sources that you used to gather your information. Potentially you want to share the methodology that you use to apply to figuring out your child count number and or your overall approach. So this is not an exhaustive list, and if you all have experience in sharing this information with other tribes, feel free to plug that in the chat box. We'd love to hear other pieces that you have found critically important to share in this conferring process. Okay. And with that, let's go ahead and go to the next slide. we are very excited and very fortunate that we have a number of current CCDF tribal administrators who have volunteered to share their experiences with us over the years in working on their child count, especially around this area of conferring and working with other neighboring or overlapping service areas concerning their CCDF services. So I will actually have folks go ahead and come on camera and introduce themselves. I see Carolyn and Jamie. Lauren's not popping up for me yet. And how about Tiffany? All right. Oh, hello, Lauren. Okay, we'll give Tiffany a moment to come on camera. But how about we start with Carolyn? Do you want to introduce yourself?
Madaweka Nanami, it's Carolyn Kodaponi. I am the Comanche Nation Child Care Programs Program Director, and I'm happy to be with you today.
Jamie, do you want to go next?
Good afternoon. I'm Jamie Ware. I am the CCDF Director for the Apache Tribe of Oklahoma, and I'm very glad to be here this afternoon. Thank you.
All right, Lauren.
Good afternoon. My name is Lauren French, and I am the CCDF Director for Caddo Nation of Oklahoma.
Okay, and then Tiffany, are you with us?
I'm here. Good afternoon, everyone. I'm Tiffany Colbasa. I am the Program Director for Santo Domingo Pueblo's Child Care.
Welcome. Thank you all again for taking the time to share with us today. Okay, so I am going to get us started and ask several questions of our panelists. So I'll start with Carolyn. Could you share with us who had to be involved in the child count process from within your tribal nation?
Okay, so I've been a CCDF administrator for a while. Every year we have a like an annual budget meetings with our tribal leaders. And so we go before them and we it's for our gaming funds, but we take the opportunity at that time to advocate for the child care program and to inform them of how there's always questions every year because tribal leaders change a lot. You know, everyone knows that. So we take that opportunity and to inform them of changes that we would like to make to our child count and explain that that's how we get our federal funding. And we use that opportunity to advocate for changes that we would like to have at that time. And so we start with the tribal leadership, and there's a lot of back and forth and sharing of information and how our federal funding works, which was all explained on the slides by Merrill in the Office of Child Care. So we have to explain that and inform them the way that we define and count our children impacts our funding. And so when we want to change it, we start from the top and we advocate for those changes, and then they give their input. And if they don't want us to change, then we go by what the tribal leaders would like for us to continue to do or not to do. So we're advocating for a change at this time. So we have already started advocating and having conversations with our tribal chairman.
Wonderful. Thank you, Carolyn, for sharing about your approach, which sounds like you're starting from tribal leaders and then they set or give you the information that you need in order to proceed before you start the conferring process and collecting data. Great. Okay. Let's see. How about for Lauren? Could you share about what any potential sticking points that you have experienced around your child count and or conferring and how you navigated those within your program?
So I am Lauren French and I have been a CCDF director for almost 8 years. So I have done 2 plan cycles. And that first, when I became a director, it was right before a new child count was supposed to be submitted. And so there was a lot of information on kind of revisiting child count. And that's kind of where that process started. I started looking at what does our child count mean? Does it affect us? How does it affect our service area? And ultimately, how is it affecting our, not just our families, but exercising our child count in a way of utilizing sovereignty. I'm always been a big advocate for our CCDF funding and the flexibility and how much it allows us to exercise sovereignty by developing our own service area, by developing our own Indian child counts, and getting to decide those in a way that our tribe deems like our in a way that our tribe wants to do that, and we don't have to follow a formula offered by OCC. And so that really kind of got me to start looking at child count very differently. And what does this number and how is that impacting the areas, and how can we utilize this number with the areas and service areas that we're kind of in Southwest Oklahoma? We're currently in 17 counties. And so there is a ton of overlapping, and each of those tribes in 2 plan cycles, so 2 child count declarations, it's changed both times, and I'm still always looking at ways to kind of maneuver that, and how that benefits either our tribal members that call in, or family members that are right outside of that service area. How can we utilize that a little bit differently? And having those conversations with our tribal leadership, but then also advocating for that too. Like, when people come to us and they are outside of that, just like a smidgen, or where is the loophole kind of in there? That, or not loophole, but where can we define that better within that? So that's always like a big component, is this allows us to really exercise sovereignty in a way that grants usually don't. And especially when they're looking at servicing grants. When you're looking at other Head Start, they're very particular about who you can service and how you can service them, and where you can service them. Same thing with HUD grants, even like CHR grants, and a lot of my people that are utilizing our assistance grants sometimes aren't able to utilize services in other grants area because of the guidelines and the stipulations that they kind of put on there. So it's always good to just kind of look at that. I know there was about a 58% of the participants today that said it's not something that they're open to or looking at, but even just having the conversation is this working for us? Is this working for us? Are we exercising our sovereignty in a way? Can we just have a conversation just with us looking at the conversation and opening ourselves to the flexibility? Sometimes is even, and finding out that what formula you have works for you, but just revisiting it and just having the conversation with new tribal administrators, where kind of the new push for our ACF funding, like what our funding is kind of pushing to, is really opening the doors to really kind of think, who are we servicing, and are we servicing them to the best of our abilities? So those are always thoughts kind of in and around like this time, looking at child count, and what number are we going to put, and do we stand behind this number? So just some thoughts for everybody kind of around.
Thank you for your insight, Lauren. It seems like you're very intentional about informing leaders, and then also being mindful of families who are coming for services and noting whether or not they're currently residing within your service area so that you can keep track of any potential unmet needs to revisit the next time the child count submission is due. Great, thank you for your expertise. How about we go to Tiffany next? And could you share with us what the collaboration process around the child count looks like for you and your program?
Sure. It's a good segue from Lauren. I do want to start off with a few points of encouragement for those that are on this webinar today, in that your collaboration process can look different and will be, what you make of it. And then just to keep in mind that your process will be unique. It's not going to be duplicated because it's really based on the uniqueness of your tribal nation and the children and families that you serve. So with that said, at Santo Domingo Pueblo, our process involves several stakeholders, such as our tribal census office, the U.S. Census database, tribal leadership, our fiscal staff, and other tribal nations. For this current plan cycle, Santo Domingo Pueblo was one of 17 pueblos within the state of New Mexico that collaborated and conferred their tribal counts. And this process took us about 9 months from start to finish. And the way in which we were able to meet was on a monthly basis. Each tribal nation took the opportunity to host a meeting, whether it was virtual or in person. I can't remember because I know, the pandemic was still playing a part in our process as well. So at a minimum, we met once a month, but towards the deadline for submitting our child count, it became probably bi-monthly for the last couple of months. And then we did shoot a bunch of emails back and forth within our email thread. So that was another piece of our collaboration was, having points of contact for each person involved. And so in this process, we shared service areas. We took time to share definitions of an Indian child. And we also shared whether or not we were serving just the children enrolled within our communities or tribal nations, or whether we elected to serve all Native American children. We also made a lot of time to understand the dynamics of the populations we were serving. So that looked like, where are our families residing, number one, where are our parents going to work and school, because that plays into the type of childcare they might be seeking. It made us look at our enrollment criteria. What is that blood quantum looking like, and how is that impacting, the number of children that we can actually count? But we generally just kept in the back of our mind, I think our goal was to ensure we were accounting for every single child, in addition to not duplicating those children that have been counted, because I personally feel that we've been undercounting children, Native children in the state of New Mexico. And so as we came together and we had discourse on all these topic areas, we were able to learn a lot more about everybody's tribal nation and what the childcare sector looks like in each of our communities. But together we were also to bridge some gaps to ensure that, we're not letting any families fall through the cracks when it comes to childcare services and other things too. So once all the information was gathered, the group collectively allowed me to expand on our current methodology, because this would have been the second time that we're implementing a methodology using U.S. Census data to determine that child count. And so based on that, I was able to research information on counties, on populations, on the number of children in certain categories, because the US Census breaks it up by groups of ages of children. And there's a lot of math involved. I would say we had to come up with a formula as well. But I'm going to read a little snippet from our methodology, and it's okay if it blows over your head, but it definitely allowed us to really understand how we were going to share in the number of Native children and how we were going to share in certain counties as far as our service areas. So to collectively serve all Native or American Indian and Alaskan Native children within the state of New Mexico, the 2020 decennial census numbers were analyzed and used to determine tribal child counts. Each county's total population and total American Indian and Alaskan Native populations were used to determine counts for the following age categories: under 5, 5 to 9, and 10 to 14. For the 10 to 14 age categories, the total number of children reported was divided by 5 to assume that 20% of the count was over the age of 13. The total amount is then reduced by the 20% to account for the age category 10 to 13. Then each age category count is divided by the total population of the county. The percentage of each age group is determined. The percentage of each age group is then multiplied to the total American Indian Alaskan Native population, which determines the total counts of the American Indian and Alaskan Native children. The child counts from tribes that are only serving their tribally enrolled children are then extrapolated from the county's total count. The remaining count is then divided amongst the tribes that will serve the all American Indian and Alaskan Native children within that county. The 2020 decennial census population counts for each of the participating tribes is used to determine the percentage of the child count that can be claimed by each tribe. So there's a lot of proportionality that's applied within this method. And so each of the tribes that were sharing in counties, this calculation was used. There were some counties where only one tribe, resided in, but maybe the neighboring tribe had children and families residing in that county. So there still had to be some discussion and, conferring and agreeing upon, how that process was going to look like. But that's what I have for you all. There's a lot that has gone into this process, but we're really happy because the end result is that we collectively have received more funding. We've been able to expand on services for families, but it's also allowed us to understand the unique traits of our communities, but also celebrating the similarities that we have. And overall, it's been a beneficial process, and it's led to more robust conversations and coming up with ways or solutions to some of the challenges that we're all facing. Thank you.
Wonderful, Tiffany. Thank you. I echo Carolyn's comment, hearing about your overall process and really centering wanting to meet the childcare needs of all Native children and families across all of your different service areas. And it seems like within the state of New Mexico is a really big and long process that takes a certain level of coordination and ongoing collaboration over a long amount of time. So thank you for sharing your methodology. I was actually following it. That made total sense to me. I've supported tribes in the past working with census data, and others had to figure out similar processes to get that really detailed information in order to count all of the Native children within their service area. So thank you. And shout out to all of the other partner tribal nations that you all worked with to come together to really create a beautiful collaborative process. So thank you again. Okay. All right. So next we are going to go with Jamie Ware, and our question for Jamie is, how often do you confer with stakeholders or partners around your CCDF program and specifically around the child count process for your tribal nation?
Okay, so I'm Jamie Ware. I am the CCDF Director for the Apache Tribe of Oklahoma. I have been in this position now for 7 months. So this is going to be my first child count. This is going to be my first plan cycle. So right now, I'm working on conferring at least with tribal leadership and our fiscal staff, seeing as how they're currently our primary stakeholders at the moment. What I'm doing right now is working on building this program from the bottom up. We are a fairly young program and there was not a director sitting in this position for a couple of years. So right now, my primary focus is on addressing the child care need here in Southwest Central Oklahoma. We are in a child care desert. And so right now, what I'm thinking about is trying to build that network of stakeholders and engaging those individuals who are going to have a vested interest in this program and this program's mission, the building project that's soon to come. And by doing so, I'm trying my best to reach out to other tribal lead agencies in this area for conducting child count, and at the same time, other counties. We have a service area right now, 13 counties. I've toyed with the idea of expanding that in this next plan cycle. A member of my business committee told me that it was expanded in the last plan cycle, so that I should maybe consider not so much as expanding the service area, but rather upping my child count, increasing that child count amount. I've got a lot right now that I'm thinking about that I'm currently considering, and in doing so, like I said before, growing that network of stakeholders that are going to have a vested interest in what this program is doing, and reaching out to those providers in other counties that are a part of our service area that we don't seem to be servicing right now. Where the tribe is based, we are primarily serving this area. We are servicing mainly families in this town, and I want to reach out to the other towns where the child care desert is the greatest and see how my program can bring in partners and stakeholders from those areas as well to kind of help to grow this program and help to grow forward its mission. And it's just a lot. Right now, it really is a lot that I'm considering, that I'm thinking about. And I'm here for this ride, and I'm just very thankful for this opportunity to be a CCDF administrator. And I look forward to doing this many, many more times. And now that probably the next time the next cycle comes, I'll have more of an understanding of how to do a child count and then kind of move forward from there. And I'm looking forward to the changes and the things that my program can do in this area. And that also includes engaging those stakeholders. Thank you.
Great, thank you so much, Jamie. I think you are not alone in that we have a lot of new administrators and or those that haven't conducted a child count yet, but it sounds like you're starting in the right place, asking the right questions, reaching out to those within your tribe that are going to definitely impact how you move forward. And I also think that there is a lot of support out there, including your regional office, our technical assistance partners, but even with other peers that we have joining us today and others involved in CCDF tribal childcare across the board in Indian country. So definitely want to thank you all for taking the time to share your expertise with us today. It was very rich. I know I learned a lot, and excited to hear how this process looks for you this time around as well as we move further along and closer to submission next year. Okay. With that, I am going to hand this back over to Meryl to walk us through data sources.
Thanks, Sarah. And I just want to echo Sarah and everybody in the chat. Really thank you to our 4 tribal lead agencies who shared their process It's always great to hear from each other, and hopefully we can encourage more of those experiences this year, so you can learn something you haven't thought about before. So we're now going to talk a little bit about data sources, not get too deep into it, but start thinking about what you need to consider when you're choosing your data sources. So if we could go to the next slide, please. You might recognize this slide if you came to our webinar in August, and I'm going to talk through it again, just because it's really important as you're choosing your data source. So there is no federal requirement regarding which data source a tribal lead agency can use. You could use tribal data, federal data, local data. The big important thing is that your data source matches your definitions of Indian child and service area. So the first step, as we said, is kind of identifying those definitions, deciding if you're going to change them, and then finding a data source that matches. It is very important that your data is valid and reliable. But what does that mean? Valid broadly means that the data is measuring what you want it to measure. So if you want to collect information on enrolled children in your tribal nation, valid data would have information on enrollment. And reliable means that if the data were collected multiple times, that you would get approximately the same information. So really, this just means that the data that you're using is collecting the information, is like accurately as best as possible, collecting the information that you are interested in. So you can kind of trust the data. Moving up, if you look at the first kind of bullet point on this slide, and you kind of heard it echoed throughout, we really encourage you all to maintain a record of your data collection process. So a way to ensure program integrity and accountability is to document your steps, your contacts, the resources, your internal policies and procedures. But like a couple of the administrators that just spoke talked about, it was really helpful to look back if you're a new administrator, or just 3 years is a long time. And so being able to document that so you have that to look back on, or the person in your position has that to look back on, it's just incredibly helpful. Even if you do decide to make changes, it's just always helpful to document that. So if we could go to the next slide, we have an interactive activity. And I'm actually going to ask you guys to get your reaction buttons ready. So we're gonna play a little game. We have 2 scenarios, and we want to know if census data can be used for both samples. So we're going to look at sample 1. And so our definition of Indian child is a child who's enrolled, who is an enrolled member of any federally recognized Indian tribe or eligible for membership in any federally recognized Indian tribe, or who is a descendant of any citizen of a federally recognized Indian tribe. And the definition of service area is the tribe's reservation, which includes X county in the city state. So if you can give me a whatever reaction of your choice, if you think census data can be used for sample 1. Actually, I don't know how I can see. I see some thumbs up. I don't know how to see a bunch of thumbs up. That is correct. I see some stars. Yes, that is correct. Census would be a great source for this sample 1. The census data collects information on Native people and children. It's inclusive of anyone who identifies as American Indian or Alaska Native, and does not only capture information on people who are enrolled in a tribe, and it aligns with that definition of Indian child. The census also includes geographic information. So for those of you that might not know, the census has a website called My Tribal Area, and it pre-populates information on each tribe's existing reservation. You can go on there. You can find, I don't think all, but many reservations, a lot. And then it'll include the census data that was collected. And so it has both the geographical information and it matches your definition of Indian child. Okay. So let's look at sample 2. So can census data be used for this sample? So our definition is a citizen who is eligible to be a citizen of tribe A. And they have us that same definition of service area. So just the tribe's reservation. Can census be used for this? Flipping through. It's good. You guys are paying attention. I don't see any emojis. Yeah, so census would not be a good choice for this sample because the census does not include information on tribal membership, right? It does have the geographic information, but it is not providing information on tribal membership. So we need to find a data source that has tribal membership information. So one last question for you all. Can tribes enrollment information be used for sample 2?
Meryl, I think we're still seeing sample 1 on the slides.
It is in the, I'm sorry, it's in the second, it's on the right.
Oh, there we go. Okay. Thank you.
Thanks, Patty. We should in the future have them on separate slides. I think that would be better. So I saw a couple of thumbs up. That was actually a trick question. I apologize. The answer is maybe. It could be a really good source if that tribal enrollment data has geographic information. So if your enrollment data also can tell you whether or not the family is living in the service area, the children are living in the service area, then you could use that. But if it doesn't include that information, then it wouldn't be a good choice on its own. And something we'll talk about in a couple slides is, you don't have to find one data source. If you can have 2 data sources that you can combine to get all the information you need, you can do that as well. So sorry about that trick question, but thank you guys for playing along. We can go to the next slide. We have this is our last poll question, I promise. But for those of you that have started thinking about data sources, we are just curious if you plan to use or are considering using any of these data sources. So we just talked about the US Census, but also this is also just some ideas. There might be other data sources that you are interested in. Maybe a local school system data from Head Start or Early Head Start, tribal enrollment, tribal vital statistics, Indian Health Service, data from WIC, Child Protective Service, Bureau of Indian Affairs, Labor Force reports, state education data, social service agencies. Okay, why don't we see what you guys are thinking about? Can we pop the results up? Okay. Oh, great. You guys are using lots of different types of data or thinking about it. And it looks like actually the biggest, the most common response is your tribal enrollment data, with about a little over 3/4 of you choosing to use that, but a lot of people also considering census, school system, and actually every data source that is up here, it looks like somebody might be considering. Great, thank you. I just want to plug again that your regional offices, your TCBC specialists, are there to help you if this is a new data source, or even if it's not, to really help you. And they know, and they have worked with tribes who have used all sorts of data sets. So they are really there to help you as you are going through your child count. If we go to the next slide. So we also wanted you all to kind of consider like the access to the data sources. So not all data like census is kind of publicly available that you can go to a website and get right away. So this is also something else you want to document if you have to request the data, even if it's publicly available online, but it's just really important to document how you access the data. You might, though, for other data sources, have to receive permission or approval to access the information. And in the green box on this slide, we've just outlined a couple pieces of information you might have to provide if you're asking for the data. You know, every data source is going to be different. They might ask for different things, but you probably are going to have to talk about the purpose and the use. Why are you requesting it? Probably your definition of Indian child or service area. So a lot of times they could cut the data and give you just what you need. The specific data you need, the date the tribe needs to receive the information, and sometimes also a statement of confidentiality. But there also could be other requests that whoever is housing the data might have for you. And again, just documenting that is always good practice. And also sometimes you can use it again. If you made the request 3 years ago, you can probably reuse what was done before, which is always helpful and a time saver. Okay, let's go. We have one more slide on content, and then we'll review some resources. So some other considerations that we just wanted to raise for you all is the first column on data sources. So really, again, thinking, do we need to use more than one data source? Are we going to have to look at multiple data sources? Even if, you know, depending on your definition of your service area, the census data on my tribal area is only really at the reservation. So if you have a more expanded definition, you're probably going to need another piece of information, another data source. Whether you might not have to connect those like in that one example, but you might need multiple data sources. Do you have access to the data? So do you need to request it? So you need to just kind of think about that. And then also, do you have the internal capacity to analyze the data? Are you going to be analyzing the data? Do you feel comfortable doing that? Do you need to ask for some help for somebody else, maybe to help you analyze the data, but just making sure that you've thought of all those things kind of well in advance so that you're not surprised at the end. And then the other thing that we just want to highlight is the timeline, and just make sure you're all muted. The timeline, and make sure that you've kind of really thought about how much time it'll take. How much time will it take to get the data? And then how much time will it take to analyze the data? Do you have internal approval timelines? So we heard a lot about tribal leadership. Do you need to present the child count to tribal leadership? Is that in your timeline? So this is due in CARS, July 1, 2025, which feels far away, but I promise it'll come up quickly. So it's important to just like think about your timeline and make sure you have enough time to really do all the processes that you need to do. And just as a reminder too, for our direct funded tribal lead agencies, you're also going to be working on the plan at this same time. And so, and your regular day jobs, which I know take up a lot of time, and so you want to just make sure that you're not leaving this without enough time to complete it. So with that, I just want to highlight, if we could go to the next slide and then one more. Resources. So we are here for you. I think that is the big thing we want to say. This QR code is directly to our Tribal Child Care Capacity Building Center's website on the child count. They have wonderful plethora of resources that are really helpful and can really help walk you through checklists, explanations of everything. And you can get there with this QR code or with the website here. They're also updating websites, resources continually. So there'll be new resources that can really be useful for you. So really encourage you to look there with any questions. If we go to the next slide, we also have a QR code on here on the left. If you don't know who your regional office is, that will give you contact information for the regional program manager. And they will help you with our OCC regional staff, who are really fantastic support for you as you go through this. And then the other QR code on the right is to TCBC's main website. So if you have any questions besides just on the child count, they have wonderful resources at that QR code. And with that, I think I just want to pause, Sarah, since we have a little bit of time. If anybody has any questions, you could put it in the chat or come off mute. And if we can answer those, we're happy to. I think, so I see a question and about asking about the declaration sheets. And it was in response to another comment, but I'm gonna answer it. And I might answer it wrong, so please tell me. So if you are not in a consortia, you do not have to upload any documentation. You will in CARS just have to enter your definition of a needy child and service area if you're direct funded, and then the number, your child count number. You won't have to upload any documents. If you are part of a consortia, the member tribes will have to upload a document that serves as both their declaration and demonstration. But that's a big change that we made from the last round, that you wouldn't have to upload that. Okay, well, not seeing any questions in the chat, I just want to thank you all again for attending. Again, if you have questions, reach out. We are here to help you, and have a great afternoon. Thank you all for attending.
Thank you all. Have a good afternoon.